Good evening, everyone. I'm Shameika Rhymes. I am your Soulibration host. Let me know how you're doing, how your week's been going, where you're watching from. Drop that in the comments. You guys, it is July, obviously, but July is Fibroid Awareness Month. And fibroids are a common yet often misunderstood health issue that affects many women, especially Black women. And someone you know, or maybe even yourself, you're dealing with them. I mean, I'm going to be transparent for a second. I dealt with them for over 10 years, multiple surgeries, all the things. But tonight we're going to take a closer look at the symptoms and treatment options for fibroids. Dr. Latasha Murphy is a board certified gynecologist and surgeon. She's going to be joining me tonight. And so make sure you share this episode, but also drop your questions in the chat because this show is going to kind of be a shorter one than usual. But make sure you get those questions in early so Dr. Murphy can answer them throughout the show. But let me give you a little background on Dr. Murphy. Like I said, she's a skilled board certified gynecologist and surgeon, and she works at the Gynecology Center at Mercy Medical Center in Baltimore, Maryland. And she's been recognized by her peers as a top doctor in Baltimore Magazine. Dr. Murphy is, wow, she's got like all the accolades here. She's like a select group of physicians in the Baltimore area that offer the Accessa ProView system. And we're going to get into all that, but let's bring Dr. Latasha Murphy on and just dive into this topic of fibroids. And let me know if in the comments if you guys are dealing with fibroids or know someone that is, and what treatment options that you've already done or what you're curious about. Hi, Dr. Murphy.
Hi, Shameika. Thanks for having me on the show.
Thank you for coming and being able to dive into this topic because I think I was sharing with you earlier, like I've had fibroids, and I'm sure you've seen all kinds of cases on your job. So for those that are not aware that may be watching, can you describe to us what fibroids actually are?
Sure. So fibroids are actually solid benign tumors in the uterus that originate from the smooth muscle cells of the uterus. They can be found in really all parts of the uterus, inside the uterine cavity and the muscle of the uterus, or even to some degree sort of hanging off of the outside of the uterus. All those can cause different symptoms.
Ooh, so speaking of those symptoms, because I'm gonna be honest, like some of those symptoms I was not ready for. I didn't know what was happening to my body, but can you give us some of those symptoms, what they may look like? Because and if there are some that are atypical, because I think I had some of the atypical ones.
Absolutely. So the most common symptom that people have that bring them in to be evaluated is going to be bleeding, right?
Mhm.
When someone's menstrual cycle is going haywire, bleeding twice in a month, bleeding for long periods of time, very heavily, those are the kind of things that people come in to be evaluated for. But some of the other things that people may not know that is associated with fibroids is pelvic pressure, sometimes painful intercourse, frequent urination, leakage of urine, constipation, bloating. All of those things can be related to fibroids, and some people don't necessarily contribute that to fibroids and think that there's something else. Like, oh, I'm constipated. It must be a GI problem.
Right.
Right? I am urinating frequently. I must have a UTI, but never really connect those with fibroids.
So is it, hear me out. Is it possible? Because I had an umbilical hernia before, but after I was diagnosed with fibroids, literally 2 years later, I wondered if those fibroids, because it was up like kind of up here in this area. I don't know if anybody can see
Yep.
that, but but I ended up having a fibroid right in that same area that was like sitting right there. So is that possible that it could have caused an umbilical hernia or any kind of hernia?
So it could potentially worsen it because it puts stress and pressure on it.
Hmm.
But typically, having a hernia is simply because there is a weakening or defect in the fascia or a particular type of tissue layer in the abdominal wall. At baseline, there is a sort of physiologic hernia at the umbilicus or at the belly button, and that will certainly get stretched out if you have large fibroids pressing on the area.
Okay, that makes sense. So when I was mentioning, well, that was one symptom, but the other symptom I was thinking from when I had was diagnosed the first time with fibroids, my menstrual cycle stopped completely. And is that normal?
So I wouldn't necessarily say it's normal, but I also wouldn't say it's unheard of, if that makes um, so depending on the location of the fibroid within the uterus will completely determine what type of symptoms you have. So if
Mhm.
the fibroids are primarily on the outside or in the muscle and not very close to the endometrial cavity, which is the bleeding portion of the uterus,
Okay.
then it may just create enough stress on the body that you would stop having
Mhm.
sex. But if they're actually in the cavity, a lot of times you have more frequent bleeding.
Okay. Well, are there any known causes or are there any contributing factors that may cause fibroids?
Yeah, so at present, we don't know exactly what causes fibroids. We
Mhm.
know that there are some genetic predispositions for fibroids. I mean, it's hereditary. So people who have a family history of fibroids are going to be much more likely to have them. The other thing is things that can increase the estrogen level can
Mhm.
also cause fibroids to at least grow. They're not going to necessarily be the initiating factor for a fibroid
Mhm.
to be created, but it will certainly make it grow. So having weight gain can increase it. There are things in the diet that have been shown to somewhat increase fibroid burden. And those things are things like certain alcohols, particularly beer, red meat, some dairy or poultry products, specifically if they are using hormones in order to, beef them
Mhm.
up, make them meatier. So those are the most common things to cause fibers to grow.
So it's almost like you're fighting a battle because if your iron is low, which I had that too, but
Yeah,
your iron is low from the heavy bleeding, and they're telling you eat things like red meat and other things to increase your iron, but so it's like a battle you can't win. Sometimes it feels like.
yeah, it's almost like a catch-22, right? Like it's just you're doing one thing to fix the problem, but that problem could potentially be worsened by the fix of the problem it's solving, right?
Right.
It's just you have to find this happy balance or medium, which is not always easy to do,
Hmm.
especially if you don't know where the balance is, right?
Right. So, how are fibroids diagnosed? And at what point once they're diagnosed, what are the steps after that? Because I know every gynecologist is different when how they direct their patient. But what would you tell a patient or that well, let's back up. How would you diagnose them? And then what would you tell them to do after that?
Yeah, so first things first is always the history of the patient, right?
Mhm.
So I always tell people that the patients will tell you what the diagnosis is if you just listen. And
Mhm.
half the time, like you can figure out what the problem is before you ever lay hands on the patient or do imaging, to be honest. So I usually do a complete history so I can sort of narrow down what the potential cause could be. And then when we do an exam, specifically looking for the size of the uterus as well as the shape of the uterus. Typically, a fibroid uterus, especially a fibroid uterus that has multiple fibroids, you can feel sort of an irregularity or sort of bumpiness on the uterus. And
Oh.
it can also be enlarged. So a uterus that is a normal size, you are not typically able to feel that above the pubic bone. Right?
Mhm.
But if you can press on the patient's abdomen and feel the uterus, you know at baseline that there's something causing
Yeah.
that uterus to be enlarged. The most common reason for that would be a fibroid.
Okay.
So from there, you go to imaging, right? So first step is typically an ultrasound. That's going to be the cheapest diagnostic thing to do, but it's also just sort of baseline a very good cursory overview of the reproductive structures.
Mhm.
And then after that, an MRI may or may not be ordered depending on what sort of the plans are for treatment.
Okay.
And as far as treatment goes, I go through this whole spectrum of treatments, and when I talk to my patients, it's usually we go from the least invasive approach to the most invasive.
Mhm.
Least invasive, of course, you can do observation, meaning don't do anything with them. Not all fibroids require any intervention, especially if they're asymptomatic, if they're small. They don't necessarily need to have anything done about them other than watchful waiting.
Mhm.
The next option, there are medications that are FDA approved specifically for fibroids. These are medications that are designed to be used for people who have heavy bleeding with fibroids. Those two medications are called Myfembree and Orion, and they're designed to drop the estrogen level because estrogen is what stimulates fibroids to grow. right? So it attacks the hormonal component of fibroid growth and ultimately decreases the blood flow and can sometimes decrease the size of the fibroid as well. And then there are some procedures that can be done to shrink the fibroids. One is the excessive procedure. That one is done laparoscopically, where you individually treat fibroids by putting a needle into the fibroid, sort of heating up the fibroid cells, and that allows them to undergo something called coagulative necrosis, almost like the fibroid cells are melting on themselves and become like very kind of light. The typical fibroid will feel like a baseball. A treated fibroid with excessive feels like a marshmallow, right? So it takes some of the density away in addition to shrinking it down. And then another option for shrinking fibroids would be a uterine artery or uterine fibroid embolization. That's where a specialized radiologist will decrease the blood flow to either individual fibroids or to the uterus as a whole. And in doing so, you block off its ability to have any vascularity to be able to continue to grow. It also will shrink down the fibroid. And after that, you can remove the fibroids themselves, so undergo a myomectomy. There are lots of different ways to do that. You can do it laparoscopically, you can do it robotically. If the fibroid is small enough and located within the uterine cavity, you can do it hysteroscopically, so just through the cervix and not with any incisions on the abdomen. Or you can do it kind of through a C-section type incision, so a larger incision on the lower portion of the abdomen. And finally, for definitive treatment, like for those people who say, I don't want to deal with these ever again, hysterectomy is the way to go.
I'm like, where were you when I was going through? Because when you were mentioning the medicines for the heavy bleeding, I'm like, this is the first time I'm hearing of these.
Well, they are, I would say that they're relatively new. And by that, I mean in the last 5 to 6 years or so.
Okay.
That the FDA has approved them now. There are medications like Lupron that have been used for years for fibroids, but they weren't FDA approved for it. Like that was an off-label use. These,
Gotcha.
though, FDA has specifically said these are for fibroids and heavy bleeding with fibroids.
Oh, okay. Gotcha. Well, guys, we only have a few more minutes. If you have questions, drop them in the chat. I am blown away by all these options now because when I had fibroids the first time, a lot of these I don't think were available at that time. And then the second time you mentioned the hysteroscopy, which I did that first because I wanted to, well, second, I did the myomectomy first, but that was one option I tried because I thought I don't want to be out of work for a long time.
Right.
And so the downtime was not long at all. I think it was maybe 2 weeks, if that.
Honestly, a lot of my hysteroscopy patients will go home like that day, but then they'll go back to work within 48 hours.
Yeah. Yeah. And well, I had a cyst removed, so I think that's what took me a little
Oh,
longer.
yeah, absolutely. That's a little bit more involved.
Yeah. But it was the least invasive at the
Yeah.
time. So what is the downtime for those that don't know that with the myomectomy? Because I do see a lot of times people are questioning like, do I want to do the myomectomy? What does that downtime look like? Because I still want to have kids. And then to piggyback on that with the Excessa treatment, because I can't remember what my doctor said, whether
Yeah.
or not you can still have kids after you do that one.
Okay. So for the first question, what's the downtime for a myomectomy? It really depends entirely on how that is done. If
Okay.
it's done in a minimally invasive way, like if you're doing a laparoscopic approach, a robotic approach, a hysteroscopic approach, that's going to be somewhere between 2 to 4 weeks. Now, the uterus, regardless of how you do it, usually will take about 3 to 6 months to heal. But and in terms of getting back to doing your normal activities and being able to exercise and go take a walk outside, like all of those things can be done in a shorter time frame if it's minimally invasive. If you do the sort of C-section type approach or the larger incision, you're looking at closer to a 6 to 8 week recovery.
Yeah.
But again, the uterus takes about the same time to heal. As far as can you have kids with the excessive procedure? The answer to that question is yes, but FDA does not approve this procedure at this point to be sort of fertility sparing, if you will.
Gotcha.
So for a lot of things that we do in medicine, we use things for off-label, non-FDA approved reasons. And the person who actually developed this procedure, I had the chance to meet him actually, and he uses it almost exclusively for people who want to conceive. And he's had great outcomes. So
Okay. That's good to know because I don't know why I keep thinking maybe it was a different procedure where the doctor said if you do this one you won't be able to have kids, but
So
I don't
uterine
remember.
artery embolization is one that we don't recommend having kids afterwards. And the reason for that is because when you decrease the blood flow to the uterus, then if a pregnancy comes along, which requires a lot of blood flow, like
Yeah.
you're limiting the amount of blood flow that you can have for a growing gravid uterus.
Gotcha. Okay. So I just thought of this question because I know probably somebody is going to ask or they're wondering, do hair relaxers cause fibroids?
There are a lot of studies that really support that there are some chemical changes that do
Mhm.
at least increase the fibroid burden, right?
Okay.
I think there are some confounding factors there in terms of like the number of people who have fibroids compared to the number of people who've had relaxers. But if you think about it, 80% of African Americans have African
Mhm.
American fibroids, right? Um, and a large majority of us at some point in our lives probably had a relaxer, right?
Yes.
But so I think it's just confounding, truly. I'm not sure that um, that there's a direct correlation. If you
Okay. Okay. Now, are there any things that women could do to potentially prevent, since some of it may, like you said, it may be hereditary,
uh
but is there anything women can do to kind of as best they can prevent these fibroids or at least from growing more?
Yeah, honestly, the biggest thing is going to be staying as healthy as possible, right?
Mhm.
So trying to minimize adipose tissue or fat cells. So there are two places where estrogen is formed, which again is the driving force for these fibers to grow. The ovaries, which obviously can't get rid of those unless you do a hysterectomy, and I'm not proposing you do that to treat your fibroids. But the other place is fat cells can also produce estrogen, which a lot of people don't know. So maintaining a healthy weight is very important in making sure that fibroids don't grow. In fact, I had one patient who I did probably two myomectomies on, and we've had this conversation about, making sure that you can do some behavioral modifications, weight loss, that kind of thing to help prevent the fibroids from coming back.
Mhm.
Because after the second surgery, she actually did it. Like she dropped 40 pounds, she kept it off. We've been watching, this was 2018. We've been watching her fibroids. She has not required another procedure since then. Um,
Wow.
Her fibroids are staying somewhere between 1 to 3 centimeters. Like it,
Wow.
so that's not the case for everyone, but truly, like there is something to be said about staying as healthy as possible and minimizing the external or
Mhm.
peripheral conversion of estrogen, which stimulates these things to grow.
Okay. Guys, if you have questions, drop them in the chat right now because we're almost out of time. So I have heard this as well about fibroids, and I don't know how much truth it is, but it sounds like his stress can be a factor. But trauma for because I've heard that could be related to it, that if you've experienced some kind of trauma in your life and you just hold the stuff in, that it can cause the fibroids to grow. Is there any truth to that?
So again, I think that that is probably in an indirect way in the sense
Okay.
that trauma oftentimes will lead to some degree of depression, which then leads to some degree of weight gain, which then leads to some degree of stress, which increases cortisol levels, which increases estrogen, and there you go, fibroids have started to grow again. Um, and so I don't think it's a direct cause.
Okay. Well, what advice would you give to women who suspect they potentially could have fibroids and they have no clue what doctor to call, who to go to? What would you advise them to do?
I would say to go see a GYN, go see a gynecologist. And also, I would also make sure that whenever this diagnosis is or is not, or is confirmed, that they are asking questions about what the various options are. Because as we've already talked about earlier today, there's more than one or two options to deal with fibroids. That
Mhm.
it depends entirely on what the ultimate goal is, for the treatment of the fibroid. So
Okay.
advocate.
Well, that was going to be my next question. Advocate, and would you suggest second opinions? I'm queen of second opinions. I didn't do it with my myomectomy, and 2013. I did not do that and regretted that decision so bad because I didn't
Yeah,
do my research and ended up I had a whole issue after that myomectomy that could have probably
sure.
been prevented had I done my research.
I might be the minority of doctors that will tell you this, but I am a firm believer in getting a second opinion if you do not feel like you're getting what you need out of the person that you're seeing, right?
Mm,
So I tell everyone that I schedule for a surgery that if you are not comfortable, you need to go see someone else and make sure that you are getting what you think you're getting, right?
mhm,
Because the one thing that you never want to do is have someone put you under anesthesia and you are at their mercy and you're not completely
yeah.
comfortable with what's happening, right? So
Mhm,
I personally have no problems with a patient of mine going to seek a second opinion because I think the more knowledge the patient has, the more likely they are to have an informed decision about what they want to do. And if
mhm.
it's supposed to be what we have discussed, then they'll come back and we'll do the procedure. Right. So
Right. Now, this is going to sound really crazy, and I feel like I should know the answer to this, but I don't. So I ended up going to a gynecologist who diagnosed the fibroids, but she's not the one that did the surgery
yeah. Mhm.
just because she wanted to wait and see, even after I knew that there clearly was an issue that I needed addressed immediately. So I did get a second opinion, but I went to a surgeon that specialized in women's health. And so I guess the question would be, do all gynecologists do surgeries?
No.
Okay, I didn't
And
think so.
so we are all trained to do
Mhm.
surgery. I personally did a fellowship in minimally invasive gynecologic surgery, so I specialize in complex gynecologic surgeries, which most gynecologists are not,
Mhm.
but they are absolutely capable of doing surgeries for all kinds of GYN
Yeah.
conditions. And some gynecologists are honestly, they either just do OB, so OB-GYN, and just do the obstetrics and delivering babies, and
Okay.
they don't do any GYN surgeries.
Mhm.
And others are essentially office-based gynecologists. So they might do like minor procedures in the
Mhm.
office or hysteroscopy, but they won't do major surgeries.
Okay. That helps because I think when women are looking for someone to talk to about their fibroids, they should probably make sure they're going to the right person that
Yeah,
can help.
definitely.
So thank you so much. But of course, I ask this of all my guests. What feeds your soul?
Oh man. Um, in terms of work or anything,
Anything.
honestly, what feeds my soul is being able to have quality time with my family.
Mhm.
So, um, I have two little boys, and being able to like be at all of their events and be involved and not constantly working or being in sort of doctor mode, but
Yeah.
being able to be a mom is really what feeds my soul.
Oh, I love that. Well, I want to thank you for coming on Celebration, even though you're a little under the weather today. I want to thank you so much for making the time to educate us on fibroids, especially with it being Fibroid Awareness Month. For everybody, for more information on fibroids and reproductive health, head over to blackdoctor.org and read all the articles. And as for me, I will see you guys next Wednesday at 7 o'clock for a celebration where we'll be taking a look at the benefits of walking. So have a soul filled rest of the week.
Thank you so much, Shameika.
Thank you.